Hey, this is Greg Bledsoe, and I wanted to just answer a quick question. I get this all the time at our ExpedMed events. And the question is, what medical society should you, as an interested person in expedition or wilderness medicine, what medical society should you be looking at? Now, ironically, about a year ago, I wrote a very controversial blog post on Freelance MD entitled, Are Medical Societies Irrelevant? And the purpose of that post was just sort of to question this underlying dogma that every physician always needs to be involved in one or more medical societies. And my argument then, and I stand by it, is that not every physician needs to be involved in a medical society. The medical societies of the past were very big on really three things: networking, education, and promoting proper practice guidelines, and then lastly lobbying. And with modern technology and sort of the dismal state of our lobbying efforts as a medical community, I really don't think that formal medical societies are a necessity for every physician in this day and age. Now, obviously, this was a very controversial position, and folks, even within the American Medical Association, became very upset about this. I got a number of responses from a certain member of the PR department for the AMA. I know he was with the PR department because he had to give us his email address before he posted on our website. But I'm not going to call him out. We appreciated his input. But he wrote a number of posts on our Freelance MD blog, basically castigating me for calling them in question. But that's not the purpose of the video blog today. The video blog today is to talk about medical societies that you might be interested in joining if you are into wilderness and expedition medicine. And interestingly, in spite of the fact that I wrote this blog post that people said was tearing down the foundation of medical societies or whatever, I'm actually, when it comes to expedition and wilderness medicine and building a career in those fields, I'm very much in favor of people joining medical societies. And the reason for that is that if you're interested in wilderness medicine, you're going and you really want to go deep into it and make it a career. You're really going after a handful of jobs. There aren't very many jobs that pay a high enough salary to support yourself. So if you're interested in making a career, you really need to network and sort of build a solid group of friends and colleagues who know you and respect you so that your name will come up when job openings arise. And the only way to really do that is to join one of the big three medical societies and begin to get to know people within them. And the big three medical societies are in really no order of preference. They're all very good. The Wilderness Medical Society, the International Society of Travel Medicine, and the American Society of Tropical Medicine and Hygiene. All three of these organizations are really well run. They have a number of members. They produce academic work and journals, and they also produce conferences every year, run conferences that promote their values and practice guidelines and provide educational opportunities for interested people. Excuse me. And it's really they're exceptional in their own way. I don't think you need to be a member of all of them necessarily, but selecting one and really getting to know the individuals within that society would be very important if you're thinking about a career in wilderness medicine. I'm going to put the links to these websites below this video. I'm also going to put links to those blog posts that I mentioned, and you can sort of make your own judgment on my opinions. But these three societies, I think, are exceptional. I have friends and colleagues in all of them. The Wilderness Medical Society, we've had a number of members from the leadership of the WMS lecture at our ExpedMed events. The recent past president of the International Society of Travel Medicine spoke at or speaks regularly at our ExpedMed events, Dr. Alan McGill. And Dr. David Schlemm, who's an executive board member of the International Society of Travel Medicine, also spoke this year. So we're big fans of all three of those organizations and would encourage you to take a look at them. One other organization that I mentioned, it's not a medical society per se, but it is a professional society, and it's one that a lot of physicians don't think about when they think about networking and furthering their group of colleagues within the field of wilderness or expedition medicine, and that's the Explorers Club. The Explorers Club is based in Manhattan in New York City, and it's been around for over 100 years. It's not a medical society per se, but there are a lot of physicians within it. To become a member, you have to have done something to further exploration, and in a future blog post we're going to be talking about how you can become a member of the Explorers Club, and I'm going to lay out some steps for how you do that and how we can possibly facilitate your membership if you're qualified. If you're not qualified, and we'll talk about what it means to be qualified for the Explorers Club, there's really nothing we can do, but we can certainly point you in the right direction and give you some contacts and some information about the organization. I think it's an exceptional organization and one we recommend. Matter of fact, the vice president of the Explorers Club, Dr. Ken Kamler, has spoken numerous times at our expedition medicine events, ExpedMed, and we consider him a very good friend and a trusted colleague. But that's basically it. So if you're interested in becoming a wilderness medicine or expedition medicine physician and making it your career, I think you need to strongly look at either the Wilderness Medical Society, the International Society of Travel Medicine, and or the American Society of Tropical Medicine and Hygiene, so that you can begin building your network of peers and colleagues and friends that you can draw upon and learn from while you start moving out into your wilderness medicine career. Thanks very much.